Namaste, my name is Dr. Divya, and today I am welcoming you in the lecture of yoga therapy. Today we are learning about the therapeutic skills of the musculoskeletal disorder, and in this specific part today we are heading forward towards the disorder which is known as the lower back pain, which is very common in today's era. So we'll learn about it. Low back pain and the neck pain are among the most common reasons for the healthcare visitors, right? The pain usually results from the problems with the musculoskeletal system, most notably the spine, including the bones of the spine, backbones, or the vertebral disc, and also the muscles and the ligaments that supports of it. Occasionally, the low back pain results from a disorder that does not involve the musculoskeletal system. Low back pain becomes more common as people age, affecting more than half of the people over 60, and also very less than that. It may be very costly in terms of healthcare payments, disability payments, and also the missed work. The spinal column consists of backbones, which is the vertebral column. There are shock absorbing discs in between the vertebrae, in each of the vertebral. These discs have a tough outer layer which is fibrocasting the soft jelly-like interior called the nucleus. Each, each of the vertebrae has two joints between the disc. These joints are called the facet joints. The facet of one vertebral body rests on the facets of the below it. So forming a joint, thus facet joints and also are stabilized by the ligaments and the muscles. Next part is the types of back pain. Common types of back pain represents the local pain, radiating pain, and the referred pain. Local pain occurs in a specific areas of lower back. It is most common type of back pain. The cause is usually a small disc injury, joint arthritis, and muscle sprains and strains. The pain may be constant and aching, or at times it is intermediate and sharp. Sudden pain may be felt when an injury is the cause. Local pain can be aggravated or relieved by changes in the position. And also the lower back pain may be sore when touched, and also the muscle spasm may occur. Second one, the radiating pain that travels from the lower back to the down of the leg. The pain is dull, achy, and sometimes it is sharp and intense. It is typically involves the side or the back of the leg, or may travel all the way to the foot or to only to the knee. Radiating pain typically indicates a compression of a nerve, root caused by the disorders such as the herniated disc, sciatica, osteoarthritis, or spinal stenosis. Coughing, sneezing, straining, bending over while keeping the leg straight may trigger the particularly the radiating pain. If there is pressure on the nerve root, the pain may be accompanied by muscle weakness in the leg, and also pins and needles sensation, or even the loss of sensation. Rarely, people lose bladder control, and also the bowel control is loosened in that pain. Referred pain is felt in a different location from the actual cause of it. For example, some people who have a heart attack feel the pain in the left arm. So referred pain from the internal organs to the lower back tends to the deep and aching, and also the exact location is hard to the pinpoint in that pain. For example, you can say somebody has the problem of the cervical spondylitis, so they can feel the pain even in the shoulder, most of the part of the shoulder. Causes of the lower back pain. Most back pain is caused by the disorders of the spine and joints, muscles, ligaments, nerve roots, and also the disc between the vertebrae. Often, no single specific cause can be identified. Any painful disorder of the spine may cause the reflex tightening spasm of muscles around the spine. This spasm may worsen the existing pain. Stress may worsen lower back pain, but also how it does so it is unclear. Occasionally, back pain is due to the disorder outside the spine, such as the gynecologic disorder, example, the premenstrual syndrome, and for example, the kidney stones and urinary, for example, the infections of the kidney, bladder, and the prostate gland, and the digestive tracts, for example, diverticulitis and disorder of the major arteries near the spine. Common causes. Next one. So, what are the common causes of the lower back pain? Injuries to the muscles and ligaments. It is given in that. The first one, osteoarthritis, vertebral compression fractures, herniated disc, lumbar spinal stenosis, spondylolisthesis, fibromyalgia. In the vertebral compression, you can say, for example, in between the vertebral column, there is a crack. So that crack gives the vertebral compression in that. Another one, it is, you can say, the lumbar spinal stenosis. The lumbar spinal stenosis, in that particularly the nerve becomes thin and it gives the pain in the lower part of the body. The spinal, the middle nerve becomes very thin in that and gives the pain in the lower part. It becomes can be visible in the older age group. And also, injuries may occur during the routine activities, for example, lifting, exercising, moving, and also in a very unexpected way, or result from the trauma such as a fall from the car crash, etc. Often, no specific injured structures are identified with imaging tests, but doctors presume that some muscles and ligaments it can be affected. The another one is the osteoarthritis. It is a degenerative arthritis, causes the cartilage between the facet joints to wear away and also the bone spurs the osteophytes to form. This disorder is due to in the part or to the wear and tear of years of use. People who have the repeatedly stress only on the one joint or the group of joint, they are more likely to develop the osteoarthritis in that particular area. The disc between the vertebrae deteriorate and spaces between the vertebrae narrow, increasing the pressure on the facets joints, which becomes inflamed, which is the arthritis, and form bone spurs in the opening for the nerve roots. With the severe degenerative loss of disc height, osteophytes in the opening can compress the spinal nerve roots. All of these changes can cause the lower back pain and even the stiffness. Another one is the vertebral compression. So, in that vertebral compression, the fractures of the spinal vertebrae, commonly develop when bone density decreases because of osteoporosis, which typically develops as people age. Vertebrae are particularly the susceptible to the effects of the osteoporosis. Vertebral compression fractures, which may cause sudden severe back pain and accompanied by the compression of spinal nerve roots. However, most fractures due to osteoporosis occur in the upper and also in the middle back and cause the rather than the lower back pain. Okay, so this is all about the vertebral compression. The third one is the ruptured and the herniated disc. In that, the disc becomes outward and gives the pain, can cause also the lower back pain. A disc has a tough outer layer and a soft jelly structure like interior in between it. If a disc is repeatedly overloaded by the vertebrae and above and below, and particularly when lifting a heavy object, the outer layer may tear or rupture, causing that pain. The interior of the disc can squeeze through the tear so that the part of the interior bulges out, and this called the herniation. This bulge out can compress, irritate, and even damage the spinal nerves, which are the sides of it. And also a ruptured or herniated disc in the low back pain that affects the nerves commonly called the sciatica. However, imagining studies such as the magnetic resonance MRIs often shows the bulging disc in people who have no symptoms or problems. Another one is the lumbar spinal stenosis. In this, the spinal nerves become narrows, which through the center of the spine and contains the spinal cord. And also the bundle of nerves extend downwards to the bottom of the spinal cord or the lower back. It is common cause of low back pain in the older people. Spinal stenosis also develops in the middle-aged people who were born with a narrow spinal canal. Spinal stenosis is caused by such disorders as osteoarthritis and also another ones and diseases of the bone. Spinal stenosis may cause specifically sciatica as well as the lower back pain. Another one is the spondylolisthesis, is a partial displacement of a vertebrae. In this, the vertebrae becomes outward. Okay, one typically usually occurs during the adolescence or the young adulthood and caused by the injury and the fractures. A part of the vertebrae, if both sides of the vertebrae are involved, the vertebrae can slip forward a little bit, it becomes downward over the one below it. Let's suppose this is the upper vertebrae and this is a downward vertebrae. So upper vertebrae slips forward on this. And people who develops spondylolisthesis as adults are at the risk of developing lumbar spinal stenosis as well. Another one is the fibromyalgia. In that also lower back pain occurs. Is a most common cause of pain that affects many parts of the body, sometimes including the lower back pain. This disorder causes chronic widespread diffuse in the muscles and other soft tissues in the area outside the lower back pain. Fibromyalgia is also characterized by the poor sleep, fatigue, and another part is prevention of the lower back pain. People can reduce the risk of developing the lower back pain by doing the exercising. Strengthening and stretching is important in the lower back pain. Maintaining a healthy weight. Okay, do not put on so much weight. Obese type of people get easily the lower back pain. Maintaining the good postures even while you are sitting, maintaining it. The most effective way to prevent the lower back pain is to exercise regularly. Yoga is one of the important part, and also the aerobic exercises, muscle strengthening, stretching of exercises can help. So next part is all about the yogic management, how to prevent the lower back pain, what are the practices a yoga therapist should recommend, and what are the practices which should be contraindicatory or particularly worked as a limitation in that part for the lower back pain specifically. So we should start as a yoga therapist from the om chanting, from the mantra chanting, and also you can give the spinal exercises, the simple moments which facilitate the practices of further range of yogic techniques by loosening the joints, okay, specifically the loosening the joints. So the one practice which is known as Sukshma Vyayam, it is given by Swami Dhirendra Brahmachari ji. So the person can practice, most of them do not put the person in the forward bending position. Specifically, while doing the yoga practices in the lower back pain, a therapist should know the ability or a range of motion of a particular patient or a subject which is coming towards you. So, according to my perception, as a therapist, if you are not See, if you are not benefiting to somebody, so at least do not hinder or do not develop any kind of discomfort in them. So the first part in the lower back pain, that the person, you should not treat any kind of forward bending practices, particularly treat almost the backward bending practices as well as to strengthening it and to sustain the lower back muscles in a particular way. This is the most important aspect of a lower back pain. In that practices, you can refer the yoga asanas, which is very simple, and as well as like tadasan, kati chakrasan, ardha chakrasan you can practice, and also the setu bandhasan, which can strengthen the core muscles as well as the back muscles, marjari asan. These type of practices which is not involved too much of twisting and also too much of stretching, but in one position it strengthens it, right? So pranayam also, which relaxes the mind. If there is a pain, brahmari is one of the good practice. Another one we can treat with the meditation as well as the yoga nidra. So, if we'll go according to Ayurveda, the Vata dosha is actually affected in that. So, the treatment of the upper back and the lower back pain can prescribed by the oral supplements according to Ayurveda, and also the herbal enema to correct the Vata dosha, which is the Vasthi in the Panchkarma therapies also. When the Vata dosha is balanced, it helps to strengthen the joints and as well as the bone, thereby helping and relieving the pain. Abhyanga and also the herbal massage is performed on the painful area. Another effective and the best Ayurvedic treatment for back pain is the Kativasti, the traditional method in which we uses a ring, a dough, and placed on a particular back part. This dough sticks to the skin and forms a watertight enclosure into which warm or herbal oil is particularly poured. So, Vat is a dosha of cold and dry and counters the coldness, which is the pain in the specific practices. So there are a lot of tips in the lower back pain which a therapist needs to understand. Following any period of prolonged activity, begin a program of very low minimal exercises in the starting of the lower back pain if somebody is coming to you. Okay, yoga helps to stretch and strengthen the muscles and improve the postures. Low impact exercises are appropriate for all age group and also designed to strengthen the lower back, abdominal muscles group. Always do warm up before exercise and also other physical activity a little bit. Avoid sudden movements, please avoid it, which can also gives the muscle spasm. Do not lean forward abruptly in standing or sitting. Try to keep weight lifted in a very welled position. At home or work, make sure that your work surface is a comfortable at a height position. Sit in a chair with a good lumbar support and also with a proper position height for the task. Keep the shoulders back and relaxed. Sitting in the position, often periodically walk around the office or gently stretch the muscles. You can also, in sitting also, you can do the stretching practices. Rest of the feet on the lower stool. Also wear flat shoes, low heel shoes, etc. Uses the cushion, can reduce the pressure on the lower back pain. Sleep on the side to reduce the curve in the spine, and also always sleep in a firm surface. Do not sleep on a very fairy surface. Don't try to lift the objects that are too heavy, right? Keep the object close to the body. Do not twist lifting, and maintain proper nutrition and diet to reduce the it prevents the lower back pain also. Diet with sufficient of daily intake of calcium, phosphorus, and vitamin D is also promotes a good bone growth. And also any other like smoking, if you are doing so, at least try to reduce it, which is one of the aspect to generate the lower back pain, and also the stress related disorders. Try to reduce the stress and anxiety, tension on the work related place. If there is a stress, anxiety, definitely it can cause the lower back pain. So always try to reduce it, and also to eat healthy. Another one is from my side, I am giving that avoid twisting and also extending at the same time. Okay, this can compress the intervertebral joints, rely on the props like a blocks, blasters, and additionally support when you need them. If you can't reach your toes, hold a yoga belt in your hands and also loop it around your feet, and for a while be there. For lower back pain, yoga can be especially helpful to the muscles that supports to the back and the spine. For example, the paraspinal muscles that helps you to the bend of the spine, the multifidus muscles that stabilize your vertebrae, and also the transverse abdominis in the abdomen, which helps to stabilize your spine. So these muscles, multifidus, transverse muscles, paraspinal, it can helpful for your posture. So these kind of postures you may get, like for example in the Marjorie Asana, in the Setu Bandhasan, in the bridge pose or one leg extended, you can strengthen your these type of muscles. So as a therapist, my recommendation is first strengthen the muscles and then stretching it the muscles of the lower back pain, and avoid too much of the forward bending in the starting of the lower back pain if any new patient is coming to you. Thank you so much. I hope you have understood about the overall concept of lower back pain. What are the symptoms of it? What are the causes? What are the things which a yoga therapist can helps from to reduce lower back pain in the patients? And also, thank you so much. I hope you have understood it and liked my session. And thank you so much once again for showering this much love.